Good morning. Welcome to this morning session, Improving Healthcare During and After the Pandemic. Before we start, my name is Muthu Singaram. I'm one of the founders of Startup Podium and a curator of this program. Along with me this morning to talk about the topic is Dr. Krishna and Dr. Michael Fang. Krishna is from India and Michael's from Singapore. So the way we're going to do this is they're both going to give their perspective on improving healthcare during and after the pandemic, and then we will have a discussion between the three of us. So over to Dr. Krishnan to start the mornings off. I know it's bright and early, and some parts of the world is night, so that's the benefit of the pandemic. We get people from all over the place coming to listen to us. So over to you, Krishnan, to get it started.
Thanks, Muthu, for inviting me over here, and I'll be sharing my thoughts over the pandemic and how did we manage during this pandemic with the overall situation. So starting with, can I have the screen sharing?
Yeah, you share your screen.
Okay. So is it visible?
Yes, it is visible. You want to put it in presentation mode? Yeah, cool, great.
Okay. So thank you so much for inviting me over here. And to start with, the pandemic over in India started in somewhere around, the first case was reported on Jan 30th. And then the second case was on 2nd Feb, and the third case was on 3rd of February 2019. So this was the timeline where on 28th March, there were around 1,000 confirmed cases, and by 29th April, there were around 30,000 confirmed cases. And by 27th May, there were around 150,000 confirmed cases of COVID-19 in India. So what happened in Gujarat, where I belong? It is the western coast of India, and Surat is a city in Gujarat. So the Gujarat scenario was something like this. The first case was reported around 16th of March, and by 30th November, the cases crossed around 16,000, and there were around 9,000 recoveries, and we were having a series of lockdown till June, and the benefit of that was we got a lot of time to prepare ourselves to create the infrastructure that was needed to deal with COVID pandemic during this time, during this 3 months. And on June 1, the first unlock 1 happened. It was in a way a lockdown with few restrictions and few restrictions on it. And then as assumed, the cases were going to rise since June 1. So by 29th June, there were around 32,000 cases in Gujarat, and the cases kept on increasing, where you can see that by 31st July, there were around 61,000 cases, and in August, it crossed around 96,000 mark, and by September, it was somewhere around 130,000 cases. So what happened during these 2 months? Surat, the place where I belong, was the second hotspot of COVID pandemic. So as we can see, this article is on 4th of July, and the cases started to rise since June, and the situation was overwhelming with many number of cases coming across to the hospitals, and it was very evident that the cases are going to rise, and we are going towards a peak where there is going to be a lot of inflow of patients suffering from COVID-19, and the healthcare structure, healthcare facilities are going to be overwhelmed with a very big number of cases. So this was the trajectory. This was the graph where we can see on June 2, the active cases were around 4,000, and there was a peak in July, which continued till August. By July 12 and in August, it was peaking. It was a steep slope, which we had to deal with. So as far as talking about the healthcare infrastructure in India, according to World Health Organization report of 2017, there are around 5.3 beds per 10,000 population. And in such a situation where there is a pandemic going on and where the bed ratio is low, dealing with such pandemic is of course going to be challenging. So what we did in Surat, the Surat healthcare scenario or healthcare overview, these are the assumption, the exact figures may vary. The total bed strength would be around 12,000 to 14,000 beds, and the institutional hospitals with ICU care facility would be around anywhere around 12 to 15. And the total number of ICU beds that time Surat was having was around 500 to 600 ICU beds, wherein the number of ventilators was around 300 or maybe 400 ventilators we were having. And the population according to 2011 census is around 4.4 million. So I assume the population right now would be somewhere around 5.5 million. So with this statistics that we were having and the number of cases rising day by day, there were around hundreds and hundreds of positive cases coming across to us. So there was only one thing that we could have done, and as the saying goes, necessity is the mother of all innovations. So we commissioned Hospinet, the telemedicine or teleconsultation services on 1st of July 2020. The decision was taken on 24th June that something of this sort is needed to cater the healthcare needs of the city, and Hospinet was commissioned on 1st of July 2020, wherein a triaging system was followed. Any patient coming to the hospital was triaged whether he's eligible or fit for home isolation. If not for home isolation, there were many isolation COVID care centers that were created in the city, and the bed capacity was increased by thousands of beds within a very short span of time. And I would say the government authorities and the private healthcare providers worked hand in hand, and that benefited the citizens of the city. So triaging was done wherein patients were triaged based on their clinical symptoms and their vitals. Those who were fit for home isolations were sent into home isolation with remote monitoring like teleconsultation over the phone or video calls. Those who needed observation but they would not need, or they were not needing hospital care setup, so those patients were put in isolation COVID care centers. So they were not being treated at home, but isolation COVID care centers were having doctors and nurses around the clock for observation, and whereby if anything or the symptoms or the clinical condition of the patient, if he or she deteriorates, those such patients can be shifted to hospital immediately. So those patients were treated in isolation COVID care centers, and then the tertiary care was given at many other hospitals, including Nirmal Hospital, wherein there were proper ICU care facility with 24/7 monitoring of vitals. So how did this work? To throw some light on this three-pronged strategy that we devised within a span of like 2 weeks or 1 week. So the patients who were under home isolations, they were being contacted daily through telephone consultations or video consultations, wherein their vitals were monitored. The patients were educated and were aware about how to take their oxygen levels, how to monitor their temperature, body temperature, and what were the signs of deteriorations like increased breathlessness or cough or persistent fever or unusual weakness. So the patients were being educated, and they were being aware of the deteriorating signs of COVID-19. So in this way, we were able to do teleconsultations wherein a doctor was there who used to call each and every patient daily, asking about their vitals, what were their oxygen levels, like saturation of oxygen, SpO2, what was their temperature, what medicines they are taking, if there is any other over-the-counter medicines that needs to be added. And we also used to recommend few blood investigations every third or fifth day in the patients who required more monitoring, like those patients who were above 50 years of age, who were having comorbidities. So in such patients, we used to recommend all those blood samples and investigations, wherein the patient do not have to move out from the home isolation, but a phlebotomist goes to the patient place where he is home isolated, wears proper PP kit, takes all the precautions and collects the blood sample and comes back to the hospital. And the reports of the patients were shared with the doctor as well as to the patients through electronic medium. So this was a very successful thing that we implemented, wherein we could optimally utilize the bed strengths that the city was having. And we were not only the ones who were doing this three-pronged strategy. There were many other hospitals and many other organizations who came together during this pandemic to fight it and help the community. The other thing which I had spoken about is isolation COVID care center. So these centers were empty hotels or banquet halls, or maybe you can say any community centers which were vacant, wherein the beds were put and the necessary requirements like IV stands or crash trolleys were put, along with BP apparatus and SpO2 machines. So the patients who were not requiring hospital admission, but who requires observation, like the patients beyond 50 years of age, or the patients who are having comorbidities like hypertension, diabetes, or who are already suffering through some illness like cardiac illnesses or maybe some brain stroke. So those patients were put in such isolation centers where there was round-the-clock monitoring through a junior doctor and there were nurses. So at any given point of time where a patient deteriorates, he would get immediate attention. There were oxygen supplies provided at this isolation center, and the patient was put on oxygen or whatever is needed, and by ambulance that he or that patient was being shifted to hospital. So this was the setup in isolation care centers. So what happened by this strategy was we were able to optimally utilize our hospital beds. During the starting months of pandemic, I remember when not much was known about how COVID progresses, or there were everyone was shooting in the dark. And I remember that many of the stable patients, due to the fear of unknown, were being admitted to hospitals, because even the healthcare providers were also not aware about how the disease will progress. And there was a lot of, there was very low data on to comment on anything on the clinical status or what will happen in next few days. So as the time passed and we got more and more data from other developed countries, what's happening there. And I think in a way, lockdown helped us to buy time for ourselves, wherein we could create an infrastructure for this three-pronged strategy, where we had more data on the clinical status of the patients, where we had more ample amount of time where we could decide what to give and what not to give. Like, as for example, blood thinners or anticoagulation therapies were being used in such patients. So that was a boon for us. We got ample amount of time. We bought time due to, and there was lockdown. So there was low transmission among the community during the lockdown period. So all these things helped us, and the hospital beds which were being occupied by stable patients previously in the month of Feb or March, by I think April or June, we were pretty much clear about which patients needs home isolation, which patient needs isolation in COVID care centers, and which patient really needs hospital beds or tertiary care. So this helped us a lot in delivering a proper quality healthcare to all the patients without compromising on the clinical outcomes. So this was in a nutshell what I spoke about, the three-pronged strategy of Hospinet and Nirmal hospitals, where we did triaging of patients. Talking about few stats, I think in the month of June, where the cases were peaking and we were getting around hundreds of cases, like 500, 600 cases, or maybe many cases per day. And in July, it was still peaking and the cases were rising exponentially. In those 45 days, we were able to reach up to more than 2,800 patients. So that comes around to be 70 patients a day. And we treated many thousands of patients on outpatient departments. So how did all these things work? Talking about the hospital scenario, there were around a team of 4 intensivists, 27 medical officers and nurses. So they used to cater to the clinical needs and health needs of these patients. We had some rotational duties. These 27 medical officers, while working in the hospitals, also went for home visits. Yes, I forgot this point to mention that in this, we also had home visits by junior medical doctors to the patient's home, wherein they used to go to their homes wearing all the personal protective equipments and measuring their blood pressure and other vital signs, which a common man or maybe a layperson would not be able to elicit or see by himself or herself. So the junior doctors used to go to their home wearing PPE and used to monitor their blood pressure and other vital signs. So these 27 medical officers whom I am talking about, they used to go for home visits. There were even nurses. We used to do an alternate thing where on one day a doctor goes, on the other day a nurse goes, or in some cases in all the days a doctor goes for home visit. And those patients who were young and were not requiring daily monitoring, in those cases we were only doing teleconsultations over the phone or video calls. So this helped us a lot, and there was a team of 27 medical officers and many nurses with other paramedic staffs, which helped us to deliver this quality healthcare. So as of now, where do we stand? Today in India, these are the latest record I've taken from Ministry of Health. On 15th of December, there are around 3,39,000 active cases with a recovery rate around 95% and mortality rate of around 1.5% cases. The another thing that is to be noted is how the lockdown helped us in procuring all the healthcare facilities that we as a country needed. So just on these figures, that there are around 15 crores tests that has happened in India till date, since the day we started around 30th January. And there are around a million tests being done per day in India today. So how did we manage? And I would like to appreciate the government authorities and the healthcare authorities who worked on war footing to create this facility. I remember in January or maybe in February, there were very few couple of labs who were doing COVID-19 tests. And from those few couple, 2 or 3 labs, we have come around 2,200 labs, somewhere around close to around 2,300 laboratories across the country. So lockdown helped us in a way to decrease the transmission and side by side create an infrastructure of hospital beds and laboratories wherein we can cater the needs of the population. So this is where we stand today. What is the way forward? So COVID was a crisis for us. It was a crisis where we needed to work on war footing to deliver the healthcare needs of the community at large. But side by side, there was also an opportunity that we could see that in COVID, where we were doing teleconsultations, video consultations over the phone, and we were able to successfully deliver quality healthcare through these modalities. Then we started the same thing with our neurology and urology services. I mean, it came as an opportunity or a blessing in disguise for other things like neuro consultation. Now, I would just give an example of this where we practice teleneurology right now. Surat is a tertiary care center. It is a city, a big city, one of the biggest cities of Gujarat. And there are a lot of towns and villages around Surat where neurology services are needed by the patients, where the accessibility to neurology services is there's no, I would not say there is no accessibility, but the accessibility is low. So in those cases, teleneurology is helping us right now. Along with the team of our neuro team, like neurologists, we started on teleneurology consultations where people from periphery of the city or periphery of the, like from towns or villages, connects over the phone or video conferencing apps and teleneurology services are being catered to them. So in a way, I would say that the digitalization of the country, wherein the internet is accessible, the smartphone. Now, in the low income and middle income country like India, there are smartphone. The smartphone revolution has helped us a lot in catering to this services. So a person with smartphone and internet accessibility is can easily avail these teleneurology services, and where we have done somewhere around hundreds and more than 150 teleneurology consultations in last 2 months. And the same way like tele consultation for COVID, the teleneurologist consultations where most of the patients are uh, from beyond 50 years of age, who are bedridden, who are not able to come to hospitals often. Those patients can avail this services, and they are availing the services where they are being properly screened for their healthcare requirements, and if needed, they are asked to come to the hospitals, or they are sent to an ambulance to which they can use to come to hospital. So likewise, tele-urology services have also been started. So this gave us an opportunity and to think out of the box that if we can do tele consultation services for COVID, then why can't we do such services in neurology or urology or any other branches? So we are developing on it, and yes, there are some positives and there are some challenges also that we are facing right now. Is, for example, patients still want a physical visit by a doctor, or they want to come to meet doctor physically in the conventional setup. So the challenges that we face right now in tele neurology services or tele consultation services is the importance of touch examination and the patient rapport. So those are the challenges, but I think with proper counseling and proper giving ample amount of time to the patient and their relatives, I think such challenges can be overcome. And with the development of wearable devices like healthcare vitals monitoring devices, I think this is going to grow beyond our imagination. So this is in a nutshell where we are heading, using a digital platform to cater the needs of the community in the periphery, in the villages, in the towns of Gujarat. And as far as what I can see from here is the future is going to be technology dependent, and it is going to be bright. Using technology, we would be able to cater to thousands of millions of people by sitting here at one place in a hospital, and thereby catering to the healthcare needs of the patient and community at large. So I think this is in a nutshell. I'm open for questioning. Thank you so much for giving me an opportunity. Over to you, Muthu. Thank you. Hello, am I audible?
Yeah. Just a second, sorry, I was on mute. Thank you for the enlightening presentation. And now over to Dr. Michael Fang, his views, and then we will go on our conversation.
Okay. All right. I would like to start by first thanking Dr. Kushal, yes, for his excellent job in presenting the case study for Gundaraj, which I believe is the typical scenario that has been going on worldwide, right? The healthcare workers are basically being swamped, right, by the huge influx of patients due to the surge in COVID-19 cases. Yes, because his presentation was classical, I shall not bore you by doing another classical presentation, but what I would like to focus on is basically to discuss the impact of COVID-19 and the way forward in the future. So once again, I thank Dr. Kushal for giving us a very good basic background and understanding for which to build the conversation. Right.
Thank you, Dr. Fang.
No problems, no worries. In Singapore, we faced a slightly less daunting situation because Singapore is a country that's surrounded by water, and so therefore immigration and emigration is easily controlled. However, having said that, we were still caught very much unprepared for the pandemic. And I would, of all the quadrants that we faced in tackling this pandemic situation, I feel the first and foremost thing we should address is actually pandemic preparedness and preparation. As the saying goes, prevention is better than cure, right?
Yes.
Okay. So, yes, we have a limit on hospital beds. In Singapore, the situation is like throughout the whole country, there's only 400 available ICU beds. So, should we be overwhelmed, we'll be past the tipping point and many patients will start to die. So, therefore, in any crisis, pandemic preparation and preparedness are the most important. Okay, having said that, we were caught unaware by the speed and veracity of the situation. We also had a team, right, but it was underdeveloped. Yes, and no one knew where the pandemic was actually headed towards, and no one knew how severe it was until the first cases struck in China. So that gave us our first warning sign. So global surveillance is very important in this measure, and our global surveillance bodies must be up to scratch, must be up to date in keeping all the countries informed of the impact and severity of the situation. Secondly, what I can see from this pandemic going forward is that we should build a very good supply chain, right? Medical supply chain with good storage facilities, especially cold storage facilities that are available, right? And as well as adequate supplies of masks and ventilators, and as well as the capability to churn out these facilities in times of need. So this is a very good economic opportunity for those people who want to specialize in, cold chain supply and medical supplies moving forward. Because having a buffer for this actually helps ensure that, we have more resources to deal with the pandemic as it emerges. And this will not be the first and last pandemic that we're looking at. The human population has reached about, easily 7 billion. And the chance that the pandemic will occur in the next 4 years is actually very high. So, okay, so to prevent, more deaths and mass profiteering, we should actually focus on prevention, which means that, okay, we have a team that is up to date, a team that is on global surveillance, as well as local surveillance, as well as a plan in place, okay, for lockdown of the local population if need be. Yes, and the political will to carry it out. Now, for all that has been happening, as we can observe in the events in New York, perhaps, and in Europe, right? The expansion of civil liberties over the last 30, 40 years, I mean, it's a good thing, right? It's a good thing that we have more democracy and free will. But at the same time, the people also need to realize the stark reality of having to deal with a lockdown and the curbing of such civil liberties for that moment, yes, until such time that it does not facilitate the spread of the disease. Yes, so we have seen people, anti-maskers refusing to wear a mask, anti-vaxxers refusing to go for vaccines, right? I mean, of course, if there is a logical basis, we can accept that. But if it is purely due to selfish or non-ethical reasons, then I think we might need to have more public education on this, right? And the public ability to respond to a pandemic, yes. So I'm glad that the situation in Gundaraj is well controlled, right? And then I'm glad that that there was enough ventilators and ICU beds to deal with the situation, right? So that is what's happening during the pandemic, which is already a step too late, right? We should be hitting the pandemic hardest, right, where it first starts off, where it first begins. So yes. So other than building cold storage and supply chains, and also allocating budget to it, right, which I believe most governments going forward will start to do, which is where we are looking at. Telemedicine is another way that we can actually explore, like Dr. Kushal has said. Telemedicine does not just refer to the aspect whereby a patient gets the pandemic, and gets COVID-19 and then starts to look for help, right? Telemedicine can start in the community early, right? And also lay off the stress and burden on healthcare workers, right? And in tackling non-essential or non-essential medical or non-urgent medical issues. Yes. So with that in place, the burden on the healthcare worker is actually less, right? So looking forward, we must start to plan for the next pandemic in place, right? It's not just COVID-19. COVID-19 was actually waiting to happen. I actually predicted something like this 4 years back. In fact, 3 to 4 years back, right? Because as you can see with each cycle, the timeline of each occurring pandemic from all the way from SARS, you know, and the various outbreaks that occur from time to time, it's been getting shorter. It's been getting shorter because our human body is a mass of cells. These mass of cells actually, you know, with every disease that occur at the cellular level, these mass of cells actually, you know, provide a chance that a mutation can occur. Okay, viruses are known not to have any proofreading, and so therefore, the chance of mutation would depend on, let's say, the whole human population, right? Would you agree with that, Dr. Kush?
Yes,
Sure.
yes,
Yes.
absolutely, yeah.
So we need, so basically, there will be a budget going forward, I believe, for most governments for pandemic preparedness, right? Which will open up opportunities, not just for doctors, but for associated healthcare workers, nurses. In fact, there will be an increase in para or maybe allied healthcare workers. Yeah.
Paramedics, yes.
Yes. Yes. So this will be very interesting times. And as you know, if you are actually into the healthcare industry, you know that, okay, there will be an increased leap in vaccine technology, okay, as well as technology in utilizing medicine at the molecular level. We have now, okay, like for example, Moderna vaccine is coming up, as well as Pfizer. Yes. And this is counterbalanced by the Chinese making their own vaccine, Sinovac, I believe. So each one have its different strengths, right? Like for example, Pfizer needs to be kept at -70, and Moderna -40, and I believe the Chinese have their strengths in making inactivated virus that's coated with or irradiated with chemicals, yeah. And in essence, this would be a cheaper alternate version of what the Americans can offer. So yes, and lastly but not least is actually political will, right? The political will of the leadership to carry it out. All right, we must ensure that there's actually a healthcare team that is backed by a political body, right? Or a political link body that is able to say, look, we have a situation on our hands. We need to respond fast. Please get the people on board and, you know, start having proper response protocols initiated. Now, in places where the leadership is not strong or not committed, we have issues. We have real issues, right? So dialogue between politicians as well as the whole healthcare system, as well as the people, need to be in place and initiated, right? So this is definitely one of the things that we find sorely lacking going forward. It is not just about medicine itself. Medicine, all right, at the intermediate or late stage is about curing the patient. But at such cost, it comes too late to the human population and the human price. As we have found out to a bit of a regret in Singapore, because we have had 50,000, we have let 50,000 patients down. We've actually let it spread among the foreign workers, right, and the dorm. And I'm sad to say that because of the improper containment protocols, the situation has actually ballooned very fast. Yeah. Luckily, we were able to control it at the local community level, right? Because surveillance was high, the population was understanding, and the government, although slow, actually got around to it at the end of the day. So commendation must go to both sides, or all three sides. But as I said again, political will is actually the most important factor here. And we have got to build a healthcare structure or system in place that is monitoring the population most of the time. Yes, and that would be and again, another economic opportunity if you think about it, yeah, because because staffing, people who are in charge, get jobs, right? And this is actually this is a good paying job probably, yeah. Yeah, and these are the opportunities that we can seek to exploit and move forward, right, for the benefit of mankind. Yes. So what are your views on that, Muthu? I see that you're thinking.
Okay, thank you so much. I'm actually very intrigued and excited to hear that both of you actually are supporting what the governments in India and Singapore have done, which is, I'm sure, all the politicians will be extremely happy to hear coming from two medical professionals. Now, many people complain. India was one of the earliest places, Singapore as well, to do the lockdown. And India did it for quite a considerable amount of time. And what they always said was it wasn't actually to solve the problem, but it's actually to get ready for the problem, right? But on the other flip side, the economic people were complaining that the lockdown is, even today I see, like I am actually from Malaysia, so I see the news, I just now was reading before we came online, they're saying they're going to open the economy and all that. What are your views on this as practitioners in the health sector? And of course, this pandemic has actually, we've lost many frontline workers. I believe there's more nurses been lost in this pandemic than even the World War I. That is the report coming out. So what are your views? Do you think we should just forget about the pandemic and go straight out and back to normal? What are your views, both of you?
Kush? Well, yeah. So as far as lockdown and economic point of view is concerned, so I think the whole world has faced the same situation. There was an economic hit, and many well-renowned or very developed nations' economy has nosedived. So as far as lockdown or pandemic is concerned, yes, that is for sure that the economy has been hit everywhere, not even in India or Singapore, but everywhere. And as far as the health of the community comes, so health comes first for me. Any medical person or anything, health comes first. So when we talk about dealing with a pandemic, like what my colleague Dr. Fang has also said, that we should have global surveillance and medical supply chain, there is an opportunity. So when it comes to dealing with a pandemic, we have to have everything in our arsenal. And if we don't have any weapons in our arsenal, then we have to buy time for it. So that is the thing. There is no right or wrong in this, but what is the best possible option for the community at large? On that basis, decision has to be taken. As this is what I think, and these are my views.
Michael?
Thank you, Dr. Kush. Thank you, Dr. Kushal. Yes, my views differ slightly from his because I agree. I agree that medical preparedness and is very important, and we should not let our guard down, right? Which what happened in Singapore, because they grew overconfident, they let the guard down, and things happened. Yeah, things happened. Things got a bit slightly out of control, but we got it back under control again. But having said that, I'm taking the more holistic view of medicine. Like, for example, people need to eat, right? People need to eat. They need to get on with their lives. They need to, carry on their economic activities. If not, they'll starve to death, right? Versus the aspect of medicine whereby we need to be vigilant and conduct medical surveillance. So as far as I understand, poverty and malnutrition are the two leading causes of worldwide deaths and
Yes.
mortality and morbidity, especially in the underdeveloped nations. So they cannot afford to be locked down for too long either. So I believe a balance has to be struck, right? Up to such an extent where early preparedness measures will help to avert economic disaster, right? By having a system and a very nice, let's say, buffer of supplies in place and facilities in place. So this will actually pay off. This will pay off very well. In addition, we can see that there's a lot of economic opportunity because the world is not going back to where it is pre-pandemic. It is not. It is not. The life that we so-called know it, the usual economic booms and up and downs, is essentially going to be shorter and shorter and eventually over. The world has started to be taken over by big businesses, right? Like, the four Fang stocks that you know, right? They Google, you know, and Amazon, yes. So we have issues with that, right? With global corporatism coming to take a large chunk of this pie. But at the same time, what used to be old economies will also be gone, right? Even famous retail chain stores are essentially gone in Singapore. You know, we have heard of Robinson's closing down, right? I'm sure you've heard in overseas, you know, it's actually quite a old retail chain store that's been around for 180 years, right? Due to this pandemic, it's actually closed down. So we can see the world is changing. It is never going back to where it was. We have to adapt to online technologies, Zoom platforms perhaps, and you know, upcoming newer platforms that offer a more competitive edge, right? So this will offer the small scale businesses a way out from what they're used to, right? We need to evolve with the times, right? And catch on the opportunities for the smaller businessmen to survive. For the larger ones, unfortunately, most of them will probably be able to adapt and get a bigger share of the pie. So that's the sad truth.
That's great, Michael. And actually what you said is very, it's apt now. Many of us are quite happy working on Zoom and because we save a lot of time and so on. But I personally, and I don't know how you think, we still lack that little interpersonal skill, interpersonal connection when we do Zoom. So I find those who joined the team prior to the Zoom and who had time to spend with me are actually better, you know, as collective team members than the ones who joined us only during this pandemic time. So like for example, I run a medtech incubator. So we are actually very lucky. We are overworked because governments is putting in, there's a lot of grants coming in to look for activities in COVID. What are your views? Do you think we should be happily sitting at home, or should we sort of have something in between or something, or go back to, I mean, obviously we all say we're not going to go back the way we were before, but what are your views on this using Zoom? Do you think we are getting too much into Zoom and forgetting that, you know, personal touch?
Kushal, perhaps your views?
Yeah. So as Muthu has said that those who were using technology before COVID and those who have started to use these platforms during the COVID. So of course, there are many cases, or there are many incidences where people are finding it difficult to be productive over remotely accessing their offices or doing office work. At the same time, there are also opportunities where this is helping many organizations, specifically the IT organizations, working from home and even across the industry. So I think this would take some time. We are in a phase of transition. It is just like using a smartphone or using internet. 10 years back, people used to, we have to get used to it, and slowly and gradually I think this would also improvise. But as far as right now the present times are concerned, it is affecting productivity in some of the industries where in between a middle path has to be found out. Yeah, Dr. Fang, what do you say? Yeah.
Thank you. I thank you, Kush. I believe that essentially the reason that the office originated in the past was due to a concentration of resources, concentration of pooling of people effort to build teams and basically move forward together. So that is why, you know, business owners fork out easily thousands of dollars just to rent a place, right? Just to get their workers moving. Sometimes it's not even superficially needed as far as we can see, but this is actually the spirit and essence of why we have these things, because human bonding and human interactions are very important in building teamwork. In building a team, then you can build a business. So having known and said that, I believe at some point, at some break point, right, we will need to get back to offices, right? When the pandemic is probably over, with the increased measures and surveillance in place, people can be assured that if anything happens, they can scramble and get back. It's just like, you know, a bomb hits and then you run for the bomb shelter, but it's like you're not going to live in a bomb shelter for the rest of your life. I mean, it sounds, yes, you can eat canned sardines, you know, and bread and everything, but seriously, no, you're going to get out and get some sunshine, right? So that's the thing. I believe that in the human spirit, it will endure, and I believe it needs human interaction to thrive. So there are various aspects of medicine that actually people haven't explored about, like how human interactions actually build up healthy patient-doctor relationships, how they build up their, self-esteem, ego. So there are mental aspects of health in this pandemic that we have not addressed, some of
Yes,
which are quite sad. I've heard of cases where, people just jump off the building not because the salary wasn't enough, but because they were totally socially isolated. They couldn't deal with the pressures. So I believe this will blow over in time. We will have to come to a stage and then say, look, let's get back to work. Let's go back to the table. We need to trust the system is behind us. Yeah.
I think that's very important because my next question I was going to ask you guys was this social psychology has become it's become a topic of concern and conversation right now. And I suppose a lot of people, like you rightly pointed out, are jumping off not because they don't have money, but they're getting depressed of the social isolation. So what I keep saying during my seminars is we shouldn't be doing social isolation. We should be having social distancing, which is, totally two different activities. How do you think we can minimize that type of, mental illnesses and so on during this time? How could we help those people who are struggling in this area? I think we hear that in India, and I'm sure in Singapore too, and around the world, every day we hear in the news, there have been recent news that people are in hospital jumping off. That they're actually recovering, but they just are jumping off. What can we do to stop all those sort of acts going on in this era of pandemic and afterwards, obviously?
Yes. Dr. Fang, yeah.
All right. Okay. So essentially, mental health is very important during this period of time where patients are actually isolated and maybe sometimes even cut off from their families and friends, and some of them are working overseas. So that makes the situation worse. Right, with improved use of technology, okay, we can offer social support for them, right, whereby they can communicate with their relatives or anything, and we must make this technology accessible to them. So not just lock them up in a room, we must provide them with your own handphone, perhaps a Zoom computer with laptop. These facilities are actually quite important for them to maintain communication during these prolonged periods of isolation. Secondly, the perception of seeking psychiatric mental health or so-called psychological well-being is actually an important aspect. Educating the public that it is okay to seek help, right? Because as we evolve as a society, we are dealing with more and more high stress level cases, which brings out their underlying psychiatric conditions or comorbidities, and we have to. We cannot just say, look, I'm a strong man, I'm a strong woman, let's deal with it. It doesn't work that way, right? So as we know, depression and sometimes even conditions like schizophrenia needs treatment, right? And it doesn't have to be a disease yet, you see. It could be just a simple disorder, right? Even an affective disorder will be good enough to seek some support, counseling, and treatment, yeah? We should make psychiatric or maybe even psychological well-being a part of this, allied support community, which is good. It should not only be restricted to doctors prescribing medicine, right, or just a very confined role in that. We should expand the availability of these services. So a telemedicine psychological well-being service would be a good idea. Yes, Muthu, you're right. You have sparked something here. Yes, so that would be great. That would be great because there are certain techniques and certain ways to deal with these conditions, and not just say, look, take a chill pill, and it won't jump off. No, it doesn't work that way. It has to be structured and then evidence-based to provide the best help for these people, for these groups of people.
Kushal, you'd like to add to that?
Yeah. So I agree with Dr. Fang that people need to be in communication. So most of the times why people are expelled, people take such extreme steps is somewhere there is no expression or there is no communication with their people around them or with their family members or with their friends. So communication is the key, and we in this age where we are connected socially through various social media platforms, but still the communication that has to happen on a personal level is missing somewhere, where we miss to figure out what a person is going through. And like what Dr. Fang has said, communication and taking support of mental health through some psychologists or psychiatrists. And one more important thing that I've always felt and believed is in this capitalist society where we are living, and where we are running after targets and approaching numbers, and everything is data driven. Somewhere there is no data to assess the mental stress of what a person is going through. So somewhere we need to implement or execute or make people more aware about the psychological aspects of mental health and well-being, like finding time, just like small steps like finding time for their own self, maybe an hour in a week. So all such small, we don't need to do anything big, but start from small, and the effect would compound, like finding time for yourself, doing something that they like, or maybe a hobby. So I think all these small steps, along with unconventional therapies, would help us in overcoming the situation.
So that's fantastic to hear that. I mean, obviously, mental health is going to play a big role, just like public health has started playing a big role, which I mean was not a very big thing a couple of years ago. Today, it's the forefront of healthcare anywhere in the world. Now, how do you think we can put systems in place? I mean, you've spoken about this, having monitoring and all that, the political will. Forget about the politicians; they would do things, to benefit them, and it happens everywhere in the world. But what can the normal man in the street do to keep this? Like, I mean, we keep hearing about, for example, the US, where a lot of people don't wear the mask, and the new president, who officially confirmed yesterday, says he's asking only for 100 days of masking. So this also depends on the population to have. What do you think the population in India, Singapore, anywhere in the world could do to help the guys like you who are working in the forefront? How do you think they could help?
Well, I go first, or who goes first?
Kush, you can go first.
Yeah,
Kushal.
yeah.
Yes.
Thanks. So I think, Muthu, it's I think very simple and straightforward. Follow the guidelines. We just need to do 3 simple steps: wear mask, maintain social distancing, and hand hygiene. And it is not only in COVID, but in all the infectious disease or whatever the healthcare background. If we follow these simple steps of personal hygiene and sanitation, we would be able to avoid a lot of things in future as well. So it's very simple. I think we need to educate people more and more about, like one of the point which Dr. Fang mentioned, and I liked it, that there is a anti-vaccine lobby and anti-mask lobby. So we need to educate people, make them aware with data and logics, so what is right for them, because we have seen the benefit of vaccination throughout the last century, and we have eradicated diseases like smallpox. So definitely the right kind of information needs to be given to the population. And I believe, and it is my conviction, that social media and various forms of electronic media has to play a very big important role, along with healthcare providers and other social activists who can help the community at large. So it is very simple. Follow the 3 simple steps: wear mask, maintain social distancing, and hand hygiene.
Very good. Michael, would you like to add anything to that?
Yes, as the triad of hand washing, wearing masks, right, and social distancing is very important, right? The old term quarantine. Quarantine actually comes from the word quora, which is 40 days. 40 days. Yes. So in the olden days, people had concept of social distancing and isolating themselves when face a pandemic. So public education, right, is the first and foremost important thing in dealing with pandemics, right? And it's not just about the money, right? It's not just about, look at US. US is the richest country in the world. I mean, seriously, okay, minus China, right? But let's not get into that. But as I'm saying, money is not the key issue here. Public education is public education, and we must be aware still that having to deal with this pandemic also taxes the country a lot. So we need to, the population need to be supportive, right? But as well as educate themselves, role play and prepare themselves for each and every pandemic. The more role play you have, the more educated and the more prepared you are for the next one.
Okay. Now, we have a lot of talk right now about collaboration, better productivity, costs must come down, And we also start to talk about health security. People are worried about their data being, stolen, used, misused, and all. What are your views as practitioners? What do you think? Is it appropriate for us to share the data? How should we go about keeping health security intact?
Well, I was just going through a few of the articles on data and healthcare data. There was just report 3 days back that big cyber attack has happened in the USA, wherein many companies' data has been compromised. And there are also concerns over the data of vaccines and that is being manufactured for COVID. So I don't know. I mean, data security and cyber security is one of the concerns that we are going to see along with the development of database healthcare systems. Side by side, it also has some benefits of it, like development of COVID-19 vaccine. So in one of the articles I've read that AI was used to identify the protein that was there in COVID virus. So of course it has some beneficial effects, but data security right now is a point of concern, and I don't know, the tech guys would be able to throw some more light on this. How would we deal with this? Because yes, cyber attacks, it can happen anytime. Yep.
Michael, anything you'd like to add on to that?
Yes, I would like to humbly add on to Dr. Kush suggestions. I would also say that, with the situation going on, there is actually a role for, cyber security, especially for healthcare professionals, health professions, and as well as even technology. Yes, so this will play an increasing role in the future. So, cyber tech security specialists are very well paid and very well needed in these niches. And in addition, cyber attacks have happened in Singapore, even in Singapore, yes, whereby, huge data had been stolen from hospitals, right? Yes. And this, as long as there's greed, right, there will be data theft, right? And we do need increasing roles to safeguard the health data of each and every one of us, yeah. And unfortunately, this will drive our costs, yeah. So that's the sad part about it. Yes, but again, in every danger, there is opportunity.
So, like you say, every danger is opportunity. Now, parents would be delighted to know they don't have to send their kids to do medicine, engineering, or law anymore. They can send them to do data science, which is going to be the forefront runner in the future. Just like at one time, actuary and science was a big thing, that they didn't have enough people doing actuary science. So, data science is now becoming another new play. Now, my last question before we go offline. A lot of people are afraid to go back to where they came from. How do we sort of, even though assume the pandemic goes away tomorrow, a lot of us are still going to be very scared, very worried to go out. How do we sort of get them to say, hey, it's okay now, get back to your day-to-day routine? Pandemic is not going to stay here forever, but people are going to be still scarred over this. It's been going on for a long time, almost a year now. So how would you advise our audience when they have this sort of mental block of going back out?
Kush?
Yeah. So this pandemic has given us a lot of lessons as well, and good lessons. So as far as educating the community is concerned, I think my only message would be focus on your health, focus on the healthy lifestyle, focus on your fitness. So there was one very good lecture yesterday on this platform where it was the discussion was about not a sick care but a health care. So I would say that focus on your health. Don't focus on those activities that would make you stay healthy and not sick. So that is one thing. We have learned our lessons from this pandemic, and there is nothing to worry. Our immune system has developed since ages, and it has taken billions of years. So our bodies will get immune or habituated to the infection, and this is not the first infection that has come across humanity. This there are many more infections that will come across. So our bodies are designed to deal with such infections. So we don't need to worry about it. Yes, we have to be careful. We have to take our precautions, and we have to manage our lives in a routine where our mental health, physical health, financial health, nothing is affected. So follow the guidelines.
Michael?
Well, my take is this. I mean, to a man living in a dark cave for 90 days, I think, at some stage he's got to get out of the cave, right? And if he can't, I mean, he has friends around him. I hope his friends who are stronger, right, and more, more morally assured or confident will actually lend out a hand to his friend who's living in a dark cave and essentially just drag him out, bring him out, yes, and face a new and brighter future tomorrow.
Great. I want to thank both of you. It's been a fantastic conversation. I've really enjoyed myself. I hope you've also enjoyed yourself. And I've definitely learned a thing or two as always. And I thank you for both of you coming on so early and doing such an energetic conversation. We'll be back tomorrow morning talking about opportunities in the region with another exciting panel. And in the afternoon, we'll be talking about technology in health and so on tomorrow. So I look forward to seeing you again. And Michael, when I'm down in Singapore, let's catch up for a coffee or whenever that happens. And of course, Kushal, when I'm in Gujarat, we'll let you know, and then we'll do the same. So thank you very much.
Thank you very much. Sure, and I hope to see you in Singapore. Yes.
Yeah,
thank you very much.
Muthu. Thank you, Dr. Fang.
Thank you, Dr. Muthu. Thank you, Kush. Thank you.